Hi, my name's Niall and I'm a dentist, and I'm also a trustee of the charity called Let's Talk About Mouth Cancer. And we're working in collaboration with NHS Education for Scotland, NHS Health Scotland and the Care Inspectorate to bring you this training video and a host of resources to help you check the mouths of the people you care for and look for the early signs of oral cancer. Let's Talk About Mouth Cancer is a Scottish charity that operate nationally to teach people the skills and give them the knowledge to look in their own mouths to check for the signs of mouth cancer. And the reason that we do that is because the earlier you catch mouth cancer, the easier it is to treat. And we need you to come on board with our programme and work with the Caring for Smiles team to check the mouths of the people that you care for if they're not able to do that for themselves. So this training video is going to give you the skills and the knowledge, hopefully, to be able to carry out a 5-point mouth cancer check for the residents that you care for. It's a very simple check and it starts from the outside in, and we'll show you exactly how to go through that process. First of all, by gaining consent from your resident, and then carrying out hand hygiene and working through the process where you'll be checking the lips, the cheeks, the tongue, underneath the tongue and the roof of the mouth.
So now we go to Summerlee House in Coatbridge, where we travelled with the Caring for Smiles team and worked there with the residents and the staff of the care home to produce this training video. The mouth cancer check is simple and can be worked into the routine care that you provide to your residents on a monthly basis. The process starts by gaining consent from your resident, explaining what you want to do, talking them through the mouth cancer check and how you're going to do it. If the resident is mobile, move them to the bathroom, but if this is difficult, the check can be undertaken anywhere with good light. Before performing the check, wash your hands and wear a protective apron and disposable gloves. If the resident wears dentures, remove these before performing the mouth check. Rinse and place these in a suitable container. With the help of the Caring for Smiles leaflet and pen torch, follow the 5 steps, working from outside in. Start by examining the inside of the lips, both the upper and the lower, and then look at the inside of the cheeks. Move on to examining the tongue. Ask the resident to stick their tongue out and move it slowly from side to side, and then to lift it up to the roof of their mouth so that you can check the floor of the mouth. Lastly, ask the resident to tilt their head back so that you can check the roof of their mouth. Once the check is complete, wipe down the pen torch and return any dentures back to the resident. The things that you are looking out for whilst performing the check are white patches, red patches, ulcers, and any lumps or bumps that affect the inside of the mouth. If you note any of these things, record this in the resident's file and try to check their mouth again after 2 weeks.
I think that it is worthwhile doing. So ordinarily, if I was giving a resident their teeth to put in or assisting them put them in, I would be able to see the tongue, but I wouldn't necessarily have checked underneath their tongue or the roof of their mouth. So doing this check today has allowed me to see a lot more of the mouth and check for different signs in different areas. I found that it was quite easy to do, it was quite self-explanatory, and I think that it will be beneficial.
So if you do notice something that you're unsure about in the mouth or it doesn't look quite right to you, flag that up with your senior straight away and ask the patient's dentist to have a look. But if that patient is not registered with a dentist, don't delay. Ask the GP to have a look. So you can find out more about our charity online by visiting our website at www.ltamc.org. Follow us on Facebook and look for us on Twitter at @CouldBeYourMouth.